state statistics, we're actually changing the name fairly soon. It's going to be called statsusa.org. And actually began with the RAND Corporation as a joint venture almost 30 years ago. And then about 2 years ago, I acquired this from RAND. And so I've got a team that's running this for us right now. There are 151 active statistical databases. Most of them are socioeconomic. You can see the topics here. We've got, lots of crime databases, demographics, economics. We've put a ton of effort into expanding health. I'll give you an example of that specifically. But again, 151 of them. Some of them are extremely large. We have the largest one is a health insurance database. It has 107 million records. And so you can look at health insurance by demographic characteristics from the US on down to the census tract level. And that's one of the reasons that's such a large database. We have several advantages, we think, over others in the marketplace. Number one, data granularity. I'll give you a couple of examples right now. So there are a couple of ways to search here. You go to this database drop down and you can look at the active databases and you can sort of see here, you can search or sort by topic. So if I wanted to just sort by demographics, that will bring all the demographics up. If you want to further limit it by geographic coverage, you can pick, from US down to census tract. And so that makes searches super easy. You also might see here that the time series is about 25 to 26 years on average, or the median as well is about that. And that's something that's different from others out there as well. So that's one way to search. Another way to do it is you can simply go in and do a keyword search. And so I'll give you a sense here. Let's do deaths from diabetes. And if I could type correctly, there it goes, deaths from diabetes. And that will bring up, and so you see the hits here. There's one that is a direct match with that. So these searches will lead you to the full database, or these purplish ones, shaded ones, are what we call shortcuts. They're pre-programmed searches, so the user, it's already done for the user. So if you just click on this, certain deaths from diabetes, you see here that it brings up the diabetes death totals by US, so that it has all the counties and so forth. You can also choose, change that to rates as well. But it gives you a good sense. You can easily move from a table. If you want to go to a graph, you can customize these graphs as well. Let's say you want to do a line graph, draws there. You can choose which categories you want to include. And as you see, one of the things we've done is we estimate, or we connect the dots literally when there's missing data. So you see that as well. And then you can move to a map. And the map here, and this shows state initially. And I'll change that to county, and I'm going to zoom in on Florida, since you guys probably care a little more about Florida. And so, hang on one second. Let me minimize that. Okay. And I'm going to zoom in. So this shows those values, and if you hover over, you will see the US value, the Florida value, and then the Marion County value for this particular category. You can also download this to CSV or Excel, filter it, print it, save a search, mark it as a favorite, get a notification when it's updated, and so forth. So there's just, lots of granularity here. I think we have about 300 different types of causes of death that we have. I was going to highlight our births database. We have 297. That compares with others out there that have 10, 15. We have really tremendous granularity that no one else has. Let me show you one other one real quickly. I'll go back and do a search just to show you the census tract level. So let's say language spoken at home, or Spanish spoken at home, or something like that. So here's one language spoken at home. I'm going to go to the full database. You can choose any area. I'm going to choose Florida. And so we'll choose every area. So this has the state, counties, cities, zip codes, census tracts. And then if you want to go in here, let's pick, I'm just going to say Spanish. And let's do percent speaking Spanish. Hit submit. And you see here it loads that data. You can sort these tables. You can look to see where the Spanish language is the most commonly spoken. You can see it's in this particular census tract in Miami-Dade. Again, you can graph it, map it, and I just wanted to highlight the granularity here, the geographic granularity. So if you zoom into Tampa Bay, you can sort of see here, and you can even go into, even closer, and you can get a really good sense of, where those quote unquote hotspots are. Um, we don't just take public and private data, we actually add value to it. One example of that really quickly is our homeless database. Actually, let me just do a keyword search. That's going to be faster. So here and go to homeless. Okay, and let's say, and so it goes to, here's homeless veterans, homeless. Okay, this has about 300 different categories, about 450 different areas across the country. We add things that others simply don't have. We actually have a homeless rate here, and you might think that that's a simple thing to calculate. It is, but to actually get the population for these different areas is very difficult. So we've done that, and that's another example of that. I showed the user interface, how simple it is to move around here, to go from map to graph and so forth. If you like a trial, again, you can get that through Daniel. We're really proud of the fact that we're affordable, much more so than others out there. So we think we're better and cheaper. There's a premium option if you want to download an entire database. You pay about 20% more, and instead of going in and picking up, pieces of data, you can actually say, just give me the whole database, and we'll email that to you. And it takes about 10 seconds or something like that. One other thing, as I mentioned, we're going to change our name. And this is going to be the new look as well. So you can see it's a much more pleasing for your eyes, this sort of look. And we expect to do that, honestly, in about 2 weeks is what my sense. Last thing I want to say is that we're actually adding AI, not surprisingly. And I want to give you an example. This is early stage. We've only been working on this for about 3 or 4 weeks so far. But I'll give you I'll just repeat this search here, but this is this AI search. So you can go in under, right now you've got, 3 different databases. We'll eventually have 151. It'll be one search query for all of those. So, compare Florida and New York suicide rates since 2010, submit that. And this is in real time. We're not caching anything. At some point, we might do that, but it'll take about 10 to 15 seconds for this to load. Um, these you can actually ask it, okay, to load it in less than 10 seconds. So here's my query, here's the response, and it says suicide rates, this was Florida and New York. Florida's this, New York's that, it gives you a little bit of commentary here. The chart is not working, as you can see, but this is going to be great because it will provide people the opportunity to go in and look at very granular data if they want to on the form, or they can just say, tell me what the insurance rate is, tell me what the death rate is, tell me what the school spending per pupil is, in such and such state. And then,
Joe, I got a quick
yep,
couple of questions because
yep,
your time is almost up. I just wanted to throw these out there.
sure.
One of them is what's the frequency with which you update the databases? The other one is, you've done some comparisons to, for example, companies like PolicyMap, other like competitors of yours.
Right.
I haven't seen another graphical user interface that comes close to the ease of use that yours has. Can you just talk about those two things briefly? Because I think that can really highlight some of the strengths of Stat USA.
Yeah, so as I alluded to earlier, one huge advantage is we don't just produce 10 or 15 variables. So I know for a fact that Policy Map you mentioned has, I think, around 10 or 12 birth category variables. We have 297. If you want to know literally the number of Chinese mothers between ages 20 and 24 in Hillsborough County, Florida, we have that. So tremendous level of granularity that we have that others don't have.
Mhm.
The time series that I mentioned is another difference between the two. And we think the user interface. And I'm sorry, there was another question. What was the first part of the question?
The update frequency for your
Oh, I'm sorry.
databases.
Yeah. So we'll see if you go to the homepage, latest updates. This
Hmm.
is fewer than normal. It's usually about 25 a month. This shows that it's been about 13
Okay.
or 14 per month. The reason for that, part of the reason is that, like a lot of people, we are catching up as the federal government shutdown is catching up. And so, for example, we have a residential building permit database hasn't been updated since the shutdown in October. It's usually updated every month. So, but generally, if you go back and let's say you can go back and say, let's view updates in the last 90 days, you can see it's a lot more than that. And so it's typically about 20 to 25 per month. We try to make put out the data, analyze it, check it, put it out as soon as we can within literally a day or two of it being available.
Excellent. Okay, cool. One other thing, please just, I'd like all the presenters to do this, put their contact information in the chat as well as also just mention it during the presentation since we are going to be taking the presentations and making those available for viewing later on. I'd like to make sure that you get your information in there both
Sure.
ways.
Sure. We'll do that.
So
Okay.
yeah,
Okay.
just wrap it up with that, Joe, if you can, and then we'll move on to
Sure.
Bernie.
So again, I mean, you know what, I'll tell you our biggest challenge is just getting this in front of people. It's a noisy world. And so really appreciate the opportunity to present this to everyone today. Again, please follow up with me or, about content and with Daniel, about, a trial or subscribing. Thanks.
And I see your phone number and your email address are right down there on the screen.
And that is my mobile number. It will come directly to me.